Just as a general rule of thumb, if you go back to April, we were probably average around 6,000 deaths per day globally, and that sort of stayed pretty steady, and has dropped in sort of mid-May to around 5,000 deaths per day, and it's gone up and down slightly around that number, and it's kind of stayed very steady, as the DG has said, overall. But within that, there are countries with increasing deaths and countries with decreasing deaths. What has happened, though, at the same time, if you imagine, again, back in April, we were around 80,000 cases a day, 6,000 deaths. In March, about 80 to 100,000 cases, and again around 5,000 to 6,000 deaths. And then in May, into beginning of June, very similar. But what we've seen in the month of June is an acceleration in the number of cases. And what hasn't accelerated with that yet are the number of deaths. But we know it takes time, and there is a lag phase in that. So some of this may be lag. We may see deaths start to climb again, because we've only really experienced this rapid increase in cases over the last 5 to 6 weeks. So we may see that. So I don't think it should be a surprise if the deaths start to rise again. It would be very unfortunate, but it may happen. There is an element, certainly, of better care. And again, doctors and nurses and physicians have really learned how to better manage this case. Simple stuff from oxygen therapy to prone therapy, managing patients, picking out those patients who are likely to deteriorate more rapidly by looking at oxygen levels in the blood. So essentially managing the clinical pathways so the patients most likely to get very sick get into the highest form of care quickly, so the clinical pathway has been managed more effectively, has probably had an impact on the overall number of deaths. Certainly some of the therapies that have become available may also have reduced death rates. We've seen the likes of dexamethasone and others that have reduced the number of deaths in very severe patients, and a number of those factors. There's also the testing factor. As testing has increased, the proportion of people maybe in younger age groups who are being detected that were not detected before has increased, so the overall number of fatalities is a smaller proportion of the overall number of cases. That certainly has some impact on that, but we would expect the proportion of positive cases as the total number of cases to drop at the same time, which has happened in many places. So you're right, Imogen, it is a complex series of factors. What's good is that the death rate is stable. It may increase. We would hope to be able to collectively drive that down. What is a concern is the fact that the disease numbers are increasing day by day. And if you imagine that somewhere in April and May we were dealing with 100,000 cases a day, today we're dealing with 200,000 cases a day. And that is not purely as a result of testing. This epidemic is accelerating, and we're lucky. I hope part of it is that we've become better, and there is a difference between being good and being lucky. I would prefer to be both good and lucky, but I do think some of this at least is down to some excellent frontline doctors and nurses and their ability to detect and treat patients early, and we hope we can continue to provide them with the support they need to keep pushing that curve down. Some of it is also due to shielding and protection of older populations who I think we've learned, all of us collectively, that underlying conditions, that people in long-term care facilities are particularly at risk, and therefore shielding and protecting more vulnerable people and ensuring that they're not infected or don't get infected may also reduce in a reduction in the overall number of deaths.